Welcome back to the Thom Hartmann Program. I'm Alex Lawson, filling in for Tom. Still in studio with me, Dr. America, Sanjeev Sriram. We're going to go to the phones, right? You want to talk to some people?
Yeah.
Let's go to Jimmy in Colorado. Jimmy, you are on the line.
Yeah, I was wondering about talking about people getting healthy instead of about crying for health care. China has just surpassed us again. They have fast diet counselors now. I don't know if you guys know anything about the fast diet, but my mother just called me 2 months ago. She finally went on fasting again. The first time she did it 3 years ago, she poo-pooed it and said, it's stupid. You don't know what you're talking about, because she couldn't do the fasting. Well, she turned around, did fasting hard and heavy for 2 months, 500 calories a day for 2 months. Went to the doctor. She'd been on insulin for 4 years. They took her off insulin. They weren't going to put her on high blood pressure medication because they said, your blood pressure is so low, I already think you're on medication. There are things out there we could do to kind of like circumvent the insurance companies by getting healthy, you know. We should have programs out there more trying to get people healthy than crying about give us health care when we're, because we're making ourselves sick.
Jimmy, thanks for your call. I think, the thing I disagree with there just is the kind of way you framed it. It's like either or, right? We definitely should be taking proactive, healthy lifestyle choices. Right. We should also be honest that some healthy lifestyle choices are out of reach of some people.
Right.
And also, you can be living an incredibly healthy life and still get sick.
Right. And, in pediatrics, one of the things that really drew me to the field when I was a medical student was that there is a philosophy of wellness that we believe in pediatrics, where we frame our visits as well child checks. It's to keep checking that your child is well. It's working off of the assumption that your child is healthy. We want to keep them healthy. We'd like to do everything in our power as physicians and working with parents or guardians. How do we keep your child as healthy as possible? What is optimal health for your child, given your circumstances, housing, nutrition, all of that? So, and I think this is actually one of the things that Medicaid is working incredibly effective at, is that about 98% of parents with children in Medicaid are reporting that they have a regular place where they can take their kid for checkups, vaccinations, talking about things like nutrition, exercise. A huge amount of my work is about prevention. It's about preventing people from getting sick. It's about keeping people healthy. So I agree that I don't quite see eye to eye with the caller that that we are in the work of healthcare. There's a lot of health maintenance that we are working on. The Affordable Care Act was very supportive of those efforts, and I should say is, not was. And the fact that the Public Health and Prevention Fund kept getting raided over the last 7 years is problematic to the things that the caller is talking about, is that if we really want to avoid a sick care system and be a healthcare system, then we have to put funding into prevention.
Right, money into prevention.
Right.
The way you have preventative healthcare stuff is by having a robust healthcare system, public health.
Right.
And you actually incentivize you recognize that it's not this magical thing. And you can't just trust that people are going to get all the right information on their own about how to live a healthy lifestyle. I believe the caller was talking about fasting. Calorie restriction can be a good thing for some people. You can't just say like, oh, well, this one is the magic bullet.
Right.
And in America, people are inundated with information.
It's one of those things where I really do believe in the idea of you have to talk to your healthcare provider about are these trends, are these things that you find online, are these things that you hear about from friends and family, is it right for your personal individual health?
Right.
And that's what the purpose of having good, high quality healthcare is about, is to have venues for those conversations. And I think that one of the things that Medicaid is really doing on that end about actually looking at, well, what are all the things that we need in order to be healthy? is that there are a lot of states where their Medicaid program is closely tied to, okay, it looks like your family might be eligible for food stamps. So why don't we prevent hunger in your family by getting your family onto our food support? It looks like also your family could be qualifying for some income supports. There's a housing value. These are all the things that people need to stay healthy. They need food, housing, they need support with their income. A lot of Medicaid offices are now also helping people with, if you're trying to find work, they've got social workers who know how to help you with writing up a resume. How do we prepare for a job interview? These are the things that Medicaid is connecting communities to.
Because that's an actual holistic approach to health. A holistic approach to health recognizes that employment, that housing, especially housing, that all of these are, it's one, you can't just do one piece and expect, amazing outcomes. And I think there's a problem somewhat in our cultural consciousness of this magic bullet idea, right? Of the like, oh, well, if only they would do this.
Right.
Life's not easy like that.
Yeah.
It's actually hard work to do all of this. And the one thing I know for certain is you don't create a healthier America by destroying Medicaid.
Oh,
right?
Absolutely.
That doesn't work. There's no way, there's no path that is like, oh, well, let's cut out all of these supports and let's cut out all of this holistic look at health.
Because with block granting Medicaid, you'll never be able to acquire and train and build the staff that you would need to be able to look at patients and families and be able to guide them through the processes of, okay, this is how we are going to fight for your housing voucher. That is not going to happen when you have a block granted Medicaid, because they're really going to strip down finances and resources and funding for personnel, for building space. Let me,
in the couple minutes left, I want to delve into probably the most complicated issue around Medicaid, because we should do that. But what block granting does is Medicaid, during a downturn, so during economic downturns, that's when Medicaid is so important. It expands out to cover people who need it then. This is a misconception I think Americans have about poverty in particular, that it is a thing that you have. Not that millions of Americans will enter poverty and exit poverty. And a program like Medicaid is there when people need it. When millions of jobs are vaporized by Wall Street, Block granting specifically, it removes that possibility.
I mean, so Medicaid is our first responder during, times of economic crisis, natural disasters, epidemics, you name it. Medicaid is our first responder. And the way that it's able to do that is because it's an open commitment between states and the federal government for funding to come into a state's Medicaid program when that state's Medicaid program needs it. Best example, during the 2007, 2008, 2009 Great Recession, we were actually seeing more kids get health insurance, get health coverage, because Medicaid was bringing them into the umbrella. Where all the insurance companies cut and run, Medicaid steps up. And I think this is one of those underappreciated aspects of Medicaid, where it is doing this first responder work that you won't, maybe your family will not personally firsthand know what it is until that crisis arrives. And heaven forbid that that should ever happen. But for millions of Americans, that crisis is kind of a daily thing. If you're a senior who spent down your savings and now, you've done your best with Medicare, you're bankrupt because of the healthcare costs, Medicaid is covering your nursing home so that the rest of your family is not going bankrupt before it's their time to qualify for Medicare. So these are all the things that Medicaid is doing on a day in, day out basis that, quite frankly, when you think about it, it sounds a lot like peace of mind. And it's the biggest thing that we miss from the insurance companies. Like, when was the last time anybody associated peace of mind with an insurance company?
Yeah, I don't think that's ever happened. The bureaucracy within the insurance industry, which is, Kafkaesque nightmare bureaucracy on purpose because their business model is to take our premiums, deny our care, right? That's the problem. So Dr. America, Sanjeev Sriram, in the final minute here, where can people find out more of what you do, your writings, and, you know, your fight for health justice for all Americans?
Yeah, so our episodes are up on iTunes and podcast.com. And we are on Twitter. So if you want to follow me on Twitter, my handle is DRSRIRAM, Dr. Sriram. I'm on Twitter. You can find the Dr. America Show on Facebook. We put up a lot of great content. We're putting up content about what I'm writing, what other people are writing. You're going to see videos of average Americans letting their members of Congress have it. So yeah, come on in, be part of the discussion, and let's do this together.
Dr. America, thank you so much for joining us here on the Thom Hartmann Program. You know, just a tireless fighter for health justice, Dr. America, Sanjeev Sriram. Find his show online. Just Google Dr. America, Sanjeev Sriram. And this is the fight. I don't want to, there's no way around this. Medicaid is going to be front and center on this fight, and we're going to have to do everything that we can to defend it, to make sure that it is there for everyone who needs it. And importantly, it is the first domino as well. They're not stopping at Medicaid. Once they get Medicaid, it hits to Medicare. Once they get Medicare, the whole system comes crashing down. That's what the greedy liars on Wall Street are trying to accomplish. We're going to fight back. It starts with Medicaid. It starts right now. You're listening to the Thom Hartmann Program. We'll be right back.